Hi, I'm Dr. Shamima from EvoCyte. As you know and use in your clinic, the ASCE SLRV manufactured by Exobalm, it has 5 billion exosomes along with all the amino acid skin brightening agents. So imagine now to be able to give to your patient an equivalent product to help their skin to heal after they've had a medical procedure such as a CO2 laser or a microneedling RF. So Exobalm has designed, along with some renowned plastic surgeons in the States, an Exobalm product. So the Exobalm contains, imagine, 2.5 billion exosomes and half of the strength of the clinic ingredients inside of this. So we have the core ingredients, which are the NAD, the DMAE, or the glutathione tranexamic acid. So what you would instruct your nurse to do at the clinic is to mix the exo capsule with the balm, with the spatula, mix it in front of the patient and give it to the patient. You can even apply a small amount after the medical procedure, and you can brush it on with a brush or just gently pat it onto the face, and you will see that the redness will immediately go away, and also they will start to heal. So that's a very good post-procedure care to be given to the patient. You would advise the patient to keep the balm in the fridge and use it for over the next 14 to 21 days until they come back to the clinic.